The fourth component of the ICH E2E guideline is the principles and strategies for risk minimization and risk communication, as well as the evaluation of their effectiveness. Risk minimization measures are actions taken to reduce the probability or severity of adverse reactions associated with the use of a product. Risk communication is the process of informing and educating stakeholders about the risks and benefits of a product, and how to use it safely and effectively. The principles and strategies for risk minimization and risk communication should include a description of the risk minimization measures to be implemented for each safety issue, such as labeling changes, educational materials, restricted distribution, or post-approval studies. A description of the risk communication methods to be used for each safety issue, such as package inserts, patient information leaflets, health professional letters, or public announcements. A description of how the effectiveness of the risk minimization and risk communication measures will be measured and evaluated, such as using indicators, surveys, audits, or feedback mechanisms.
Vigilar pharmacovigilance team involves collecting and analyzing data from various sources, such as spontaneous reports, clinical studies, registries, databases, and literature. Using methods and tools for summarizing and presenting safety issues. For any upcoming pharmacovigilance projects, connect with us.